Unfortunately, we don't really have any particular drug that restores the function of the valve between the esophagus and the stomach. As a patient has GERD for long periods of time, there's more and more deterioration of the valve. And as the valve deteriorates, also affects the connection between the adjacent structures, such as the diaphragm. And so as that valve deteriorates, it starts to take the stomach with it, and that's when we start to develop what's known as a hiatal hernia. Proton pump inhibitors are the drugs which are most effective at curtailing the acid in the stomach are not meant for long-term use. You shouldn't be taking them for years at a time. They're generally meant to treat an acute episode of severe GERD or other irritation of the stomach that we call gastritis, could be related to a bacteria called H. pylori. But this is a short-term treatment and not meant to be a permanent medication. One way to think about it is that, the stomach is meant to produce acid. Acid is necessary for digestion. So one of the things that acid does, it helps us to absorb calcium. If you take proton pump inhibitors over a long period of time, that is one of the side effects that they can see is osteoporosis, which is a result of the fact that you're not absorbing the calcium that you would normally be able to absorb if the acid was present. Treatment is generally directed at fixing the valve, fixing the junction between the esophagus and the stomach.